Hi, I'm Dr. Stephen Tapanez, and today I'm going to talk about non-hormonal medical treatment options for menopausal symptoms. But first, remember to hit the subscribe button, click thumbs up, and ring the bell to be notified when we post a new video. Now, let's get started. Lately, there's been a lot of buzz about non-hormonal treatments for menopause symptoms. Why? Well, in May of this year, the FDA approved a new type of drug that treats hot flashes via a non-hormonal mechanism. This FDA decision marks just the second ever non-hormonal drug approval for menopause symptoms, and the first real innovation in this area in a long time. Hormonal therapies are very effective treatment for menopausal symptoms. However, they are not appropriate for all women, like those who have a history of breast or gynecological cancers or blood clots, and some women simply prefer not to use hormonal therapy. For these women, non-hormonal treatment options may be appealing. Until recently, women interested in using non-hormonal approaches to treat their symptoms of menopause were limited to only one FDA-approved medication, an old antidepressant called Paroxetine, sold under the brand name Bristol, and several other drugs not approved but used off-label by doctors to treat symptoms like hot flashes. But, as of May 2023, there's a new option, Fezolinetant, sold under the brand name Fezolinetant, which works in the brain to help control hot flashes. The brain plays a key role in initiating hot flashes. The hypothalamus, a structure found in the brain, is the body's temperature center. Like a thermostat in your house, the hypothalamus regulates your body temperature. During a hot flash, the hypothalamus perceives excess warmth due to changes in hormone concentrations. In response, the brain attempts to cool you down by initiating a cascade of events that causes dilation of blood vessels and the characteristic flushing and feeling of intense heat. Fezolinetant targets hot flashes at the root by helping to regulate your body's thermostat. It works by blocking the neurokinin 3 receptor, which is involved in the transmission of temperature signals in the brain. Women taking it in the trials also reported reduced sleep disturbances. Fezolinetant is taken as a once-daily capsule. It is generally well tolerated. The most common side effects are abdominal pain, diarrhea, insomnia, back pain, hot flush, and liver enzyme elevation. The other approved non-hormonal treatment option, Paroxetine, was first approved for this purpose in 2013. Paroxetine is a selective serotonin reuptake inhibitor that was the first FDA-approved non-hormonal drug to treat hot flashes. It is thought to work by increasing serotonin levels in the brain, which helps regulate mood and temperature. Paroxetine is taken as a once-daily capsule at bedtime. It is generally well tolerated, but can cause some side effects such as headache, nausea, dry mouth, and drowsiness. Several other non-hormonal drugs are sometimes used for the treatment of hot flashes, but the FDA has not approved them for this indication. Some of these are gabapentin, clonidine, escitalopram, venlafaxine, and desvenlafaxine. Generally, a woman will work with her physician in a trial and error approach until they find the treatment that works best. But given that there are now 2 FDA-approved non-hormonal options, it may make sense for you to ask your doctor about these options first. If you are experiencing hot flashes or other menopausal symptoms, talk to your doctor about your treatment options. Also, take a look at our menopause protocol for more information at lifeextension.com/menopause. Thanks for joining us today. Remember to hit subscribe, click thumbs up, and ring the bell so you never miss a new video. Until next time, I'm Dr. Tapanez from Life Extension.